So thank you so much for joining us today. We appreciate you coming here. And
Thank you.
I'm super excited because I get a lot of questions about plastic surgery and plastic surgeons, and I hope that you can help us today by answering some of these. So my first question, what surgical procedure do you find most rewarding to perform? What is your niche? What do you love to do?
So one of the appeals of the specialty of plastic surgery is the breadth of the field. So we are actually trained to do a lot of surgical procedures. So I personally enjoy facial rejuvenation procedures, which includes facelifting, facial fat grafting, neck lifts. I'm also equally satisfied by performing breast restorative procedures, which includes breast lifts, breast reduction, breast augmentation. I also take a lot of satisfaction in performing body contouring procedures, which is performed with liposuction or with abdominoplasty or variations on those procedures.
Another question that I'd like to ask is, what are you seeing in your practice when patients come in as one of the biggest trends? What are you hearing? What are your patients asking for?
I do see patients requesting more facial plastic surgery procedures. I feel we've hit a point where there's a lot of over-volumization, and I think this is most recently depicted by Madonna's appearance at the Grammys. Even prior to that, there was a trend for over-volumization, and what that does is it caricaturizes people, and it kind of takes them away from their natural look. So we're seeing a lot of reversal in that trend. In view of doing a lot of fillers, I think people are looking at facelifting sort of with a different perspective. Another trend I'm seeing is more acceptance of facial fat grafting. We perform this routinely in conjunction with facelifting. It's a great standalone treatment. I think in the past it was viewed as unreliable by patients, but better harvesting techniques and grafting techniques have made it a very reliable method for facial rejuvenation. So we are seeing more people accepting facial fat grafting.
One additional question, you're familiar with it. What are your thoughts on the buccal fat removal? It's a big trend on social media right now, and everyone's talking about it. It's all the buzz. What are your thoughts?
Buccal fat removal or bicectomy, it's a great procedure, but like every other procedure we offer, it has to be done with a certain degree of judgment. We want to understand when we perform or offer these procedures what the long-term consequences are. When we remove the buccal fat, it may, in some patients, cause the aging process to accelerate a bit. You really have to have that discussion with the patient, and you have to be careful as a surgeon not to over-resect the buccal fat, but I do think it's a good procedure.
Ozempic. I'm sure you've heard of that. It's definitely a buzz on social media, and a lot of my clients are asking about it. I also have encountered patients who have actually taken it. The extreme weight loss. Ozempic face, when they lose all their volume after that quick weight loss. What are your thoughts? How do you counteract it? I'd love to hear your take on it.
That's a great question. So these trends using a drug that's meant for diabetics to control their blood glucose found a way into the weight loss industry. Anytime you have rapid weight loss, you are going to lose facial volume, and loss of volume, I would submit, is the biggest contributor to facial aging. In terms of, are you going to lose weight and give up the facial volume? The solution is to give you the facial volume back. I've had extensive experience treating patients who have undergone bariatric surgery, which is similar in terms of the degree of weight loss and speed at which they lose weight. Really, it's a combination of facelifting or facial fat grafting to restore that youthful look following weight loss. This is a relatively new trend, and we have to see where it goes.
Explant. It comes up a lot. What do you think? What are your thoughts?
Explant refers to removal of breast implants, commonly placed for aesthetic reasons. Women tend to seek explant for a couple of reasons. One, their bodies have changed, and the implant they had 15, 20 years ago no longer fits with their body. Two is lifestyle. They've had implants, they've had children, the breast shape may have actually gotten bigger. Implants now represent a burden to lifestyle, whether it's exercise, choice of clothing. So many women have enjoyed their implants for over a decade, now they want them removed. I think it's a very safe procedure. It's effective. When we do remove the implant, we can augment the breast with your own fat at the same time, or we can simply do a breast lift, but that's something we determine at the time of consultation.
You know, at SkynBar, we focus on the non-invasive treatments, things that preserve skin health, really pace the aging process and keep you looking the best we can. But at one point, some of our clients really wanted to go that next step. They feel like they're ready to take that step, maybe to do something more surgical. I get a lot of questions around facelifting, the different types of facelift. I know there's a lot of little brand names out there like Mini Lift, etc. But essentially, from what I understand, there's really only a few different facelifts out there. So can you give me a little information on that? What are the different types? Which one do you prefer? how do you make that recommendation?
So that's a fantastic question. We hear a lot of confusion regarding the kinds of facelifts. If you think about it historically, there's always the facelift that nobody wants, and that's a skin tightening facelift. That's where the skin is simply pulled back, sort of has this wind-blown look with dystrophic skin. Dystrophic skin is that very shiny skin that occurs when skin is pulled taut. So that's what we don't want. That's a facelift from the 1990s, early 2000s. Thankfully, we've gone through some evolution in our technique. What we do now is treatment of the SMAS layer. That can be done in different ways. There's a SMAS plication, but what's more popular and what patients may be hearing about more is the extended deep plane facelift. So the plane we're referring to is the SMAS layer, which is where all the facial muscles attach. What does a deep plane facelift accomplish? It's releasing the ligaments in the face. That's one step. You can't have a deep plane facelift without that. And that allows us to pull and redrape the skin without any tension. We are also going under the SMAS layer to release those ligaments. The SMAS layer, the mobile part of it, we're able to pull back and create a more effective lift. Those are really the components of a deep plane facelift that separate it from other forms of facelift. And finally, when you do a properly executed deep plane facelift, there's really no tension on the skin closure, and that way you avoid these sort of hypertrophic or wide scars that we used to see from the 1990s. That's really what the big difference is. It's an evolution of technique from about 2 decades.
That's really satisfying to know that there are ways of doing it now without having those big scars.